Whoa, hello, hello, hello. I like the energy in the room. How's everyone doing? Good so far, yeah? Talking about health equity, you can't help but be passionate and excited. So I'm Nick St. Fleur. I'm a science and health reporter over at STAT, and I host a podcast over there called Color Code, which looks at issues of race and racism in healthcare and in medicine. And I typically cover health equity, and I do some events as well. I'm super excited for this conversation that we'll be having here. So if you were lucky enough to be at the opening session yesterday, you heard one of our panelists, Dr. Rachel Hardiman, say that racism has been hidden, insidious, implicit, and invisible, and that her big idea is to make the invisible visible. So our goal here today is to help her reach that big idea through this conversation on how to dismantle structural racism in medicine and in health. And we hope that by doing that, we're able to help people live their full greatness and glory, as Rachel said. So what we're hoping to do through this conversation is really also get all of you all involved. I'm not going to wait until like the last 15 minutes for questions. If you have a question you want to ask this panel of experts, just raise your hand and we'll be sure to get a mic runner to you. Now, with that said, I'm going to introduce the folks we have here on stage. We have Dr. Rachel Hardiman, who is the founding director for the Center for Anti-Racism Research for Health Equity at the University of Minnesota. We have Dr. Rich Besser, who's the president and CEO of the Robert Wood Johnson Foundation. And we have Dr. Aletha Maybank, senior vice president of the chief health equity officer at the American Medical Association. So to start us off, I'd love to start with you, Rachel. Last month was the 4-month anniversary of the murder of George Floyd. An event that really kickstarted a lot of this racial reckoning, or quote unquote racial reckoning, that we've seen in this country in healthcare and medicine. And from my understanding, you grew up, just a few blocks from where that happened. Tell me a little bit about what that event was like for you to be in that area, to experience it, and how it impacted your work with anti-racism.
Thanks, Nick. And good morning, everyone. I'm really happy to see so many people in the room ready to discuss what's often an uncomfortable and challenging topic. So thank you for digging in. I am from Minneapolis, Minnesota, grew up in South Minneapolis, not far from where George Floyd was murdered 4 years ago. And there's so many layers to both that experience 4 years ago and also to sort of how it has been embodied for me personally over the last 4 years, as well as the work that I do and the work I'm leading right there in Minnesota, in the heart of where this new racial awakening began. And so, I think being there on the ground and watching things happen in real time, first and foremost, is incredibly painful. Mm-hmm. Just as painful as it was for many of us who are watching on a screen, from the comfort of our own homes, living that reality and knowing that, and worrying, frankly, for the safety of my people, my community, my daughter, my parents, and anyone else, living in that community was really, really palpable. But also for me, I think it was an opportunity to lift up the work that myself and all of us on this stage and many, many others have been doing for a really long time, right? And it just hadn't gotten the recognition or the sort of engagement that it needed and deserved. And while no one should have to die for that to happen, let's be clear, I think what we've seen over the past 4 years is a lot more awareness, a lot more, certainly in the first 2 years, a lot more funding coming into, really important work on anti-racism. I think the question we need to ask ourselves now, and I think we're going to get to this in the discussion, is where are we? Where are things right now, 4 years out? And I think, so on the 1-year anniversary, I wrote an op-ed that was published in the Star Tribune in Minneapolis, and the title of it was Hopeful Yet Afraid to Hope. And in that piece, I talked about the fact that we've been sitting here saying, this is the movement has begun, and, we are ready to really, repair all, like 400 plus years of harm. But what I think we've seen, and this was why, the afraid to hope piece, is that some of that engagement, or a lot of that engagement, is starting to dwindle. And so I think, again, being in this room and seeing all these people here who are ready to talk about this issue, I think is reinvigorating for sure, because we still have a lot of work to do.
Thank you. Thank you for sharing that. And Aletha, I want to go to you as well. Tell us a little bit more about the impact of the murder of George Floyd that had on you, your work, and all that you've been doing at the AMA.
Thank you, and awesome to be here. Awesome to be in a community with people here. Awesome to see folks I haven't seen in ever, actually, for the first time because of COVID. So I actually started at AMA in April 2019 and was tasked with the job to facilitate a process to embed equity across the entirety of the enterprise of AMA. And well, in case you don't know AMA's history, it has a history of racial injustice, exclusion of Black physicians, silence during the civil rights era, but lots of other things as well. And so I was tasked to figure out, like, what was the strategy that we were going to put forward, because I think you have to have a strategy when you're at an institution. It needs to be written, it needs to be clear, especially with folks who haven't engaged in this for ever. They need to have something that they can rally behind, or we can rally behind. So that was my task for up to 2019. 2020 hit, and there was a part of it where I was like, well, how successful was this going to be? I had people who were interested. They were excited that I was there, excited that AMA was going to do the equity work. But in terms of the movement of it, the pace of it, I wasn't clear how that was going to work, right? And I took the job because I had explicit commitments. There was policy saying we had to do this. But the public murder of George Floyd in 2020 opened a door that in one way was a gift to the opportunity at that moment. And, from being in politics, most of my career was in governmental public health, starting Centers for Health Equity, all these kind of things. And I've learned in the political environment, when you have these windows, you have to push. You have to push as far and as fast as you can, because they can close. Right. You may not have it. And so my strategy, once that happened, was to be strategic. There's a lot of back operations that happens when you do this work in institutions, a lot of conversations that aren't shared, that people don't know about. I don't think this is new, but we have the explicit strategy, and then you have that kind of, I'm calling my friends and people I know saying, I need your help to help get this forward. So we had a board, who did a pledge, an explicit pledge around racism and being a fundamental issue in health. And for AMA to do that, I think was very shocking for folks, because AMA never made a position on racism. And to do it so boldly in the space of the public sphere, not even just in medicine, I think was another opportunity. And then the House of Delegates, which we have representation from across the country, then passed official policies. Not only just that racism is a fundamental health issue, but to remove race as a proxy for genetics and all of those. And it's funny because, AMA, because it's the representation of all the country, there are folks who are absolutely against this within AMA, and because they're representation across the country, and there are folks that were for it. And, there's a debate. It operates like Congress, so they actually debate these policies. So when these policies came forward, the one about, race is a fundamental issue, health issue, racism rather, for disparities, the race essentialism, that race is a social construct, not biological, and then the third one about removing race as a proxy. I was thinking there was going to be so much debate around it, but there wasn't. And my feeling is that people didn't know what that was. They didn't understand racial essentialism. They didn't understand the whole context of removing as a proxy. So those passed. The most debate was around just saying that racism is a fundamental cause of why health inequities exist. But then they passed. And because they passed, I was able to leverage the opportunity. And folks, say, I don't know how you move. You asked me this a lot, Rich. How are you able to move so fast? It was because of that moment. And once I had the policies of the AMA to say I could do this, I could leverage it. I could talk about racism everywhere because it was rooted in the policy. And so I just leveraged that moment.
Thank you, Aletha. And now, going to you, Rich. Tell us a bit about how that same moment impacted you all at the Robert Wood Johnson Foundation. What kind of new efforts did it inspire?
Yeah. Well, first, good morning, and thanks for leading this panel. And it's truly an honor to be on the stage with these incredible leaders. that moment, the murder of George Floyd, happening at the same time as the COVID pandemic, and the disparate impact that the COVID pandemic was having on Black Americans, other people of color, it led us at the Robert Wood Johnson Foundation to look really hard at what we were focused on. And it catalyzed change that I don't know if it never would have come, but it would not have come nearly as quickly. And we have focused for the past 10 years on community conditions, what we call a culture of health, where people live, learn, work, and play as driving factors. And we had been moving towards focus more on health equity, who has opportunity, who does not. But we were not talking about racism. And we would not have been talking about racism had it not been that moment in time. And I think part of it, similarly to what you were talking about in terms of folks paying attention in that moment, I think COVID, so many people engaged at the foundation were so focused on their own mortality that it gave us room to move into talking about racism in a way that there would have been much more pushback. And as we started moving into that space and funding in that space, leaders who had been working in that space for their entire careers, first they said thank you for the funding. But second, it was how long are you going to be here?
Right.
And are you going to be here when it gets hard? And we had to really talk about that internally, about what does it mean to put funding into an area if you're not committed to be there for the long haul, and the harm that is caused by doing that. And we made a commitment that this would be our focus. And we are focused now on a future in which health is no longer just a privilege, it's a right. And for health to be a right in America, you have to focus on the biggest barriers to health. And in America, structural racism is the root cause of so many of our health inequities.
And what does that mean to you in being there for the long haul?
Well, we've established what we call generational goals. And so it's taken a lot of work with our board. I mean, philanthropy is a very odd sector. I'd never worked in philanthropy before. But there are things about philanthropy that are really troubling in terms of lack of accountability. But there are things that we have that are kind of our special power, that we can stick with something when it gets hard. We are fully endowed. We don't have shareholders. We're not voted in. And so we have decided that this is our focus, and we're focusing on generational change and recognize that the change that we are working towards may not be change that we see in our lifetime. And we're trying to move away from what philanthropy often does, is looking at short-term metrics for our grantees and what they need to accomplish, which you cannot do when you're looking at something as broad and big as structural racism.
Thank you, Rich. So going back to Rachel, going back to that moment, George Floyd's murder. You had mentioned an essay you wrote, another essay you wrote around that time in NEJM called Stolen Breaths, which my colleague Usha Lee McFarling, when she wrote a whole profile on you, a beautiful profile, you should read it, she said that it calls for healthcare systems to think far bigger than they have and to help dismantle systems of structural racism, from police violence to segregated hospitals with poorer care to neighborhoods full of air pollution that are stealing the breaths and lives of Black people. Tell me a bit about what you were thinking when you wrote that essay about stolen breaths, and you're with the work you were doing then, you were really kind of at that forefront of dismantling structural racism in medicine. Tell us a bit about that.
Sure. So first I have to acknowledge my co-author who's in the room.
Yes.
And also my spouse, Dr. Eduardo Medina. And we actually, before we wrote Stolen Breaths in 2016 in Minneapolis, or in the Twin Cities, Philando Castile was shot and killed by a police officer. And I will never forget the day after that happening, sitting in my office on campus at the University of Minnesota and feeling very alone, and feeling like there was no one I could turn to amongst my colleagues in my professional community to talk about the grief and the heaviness and the pain I was feeling. And I had one colleague, Dr. Katie Kazimano, who said to me, write it down. And so together, she and I, along with Dr. Medina, we wrote that first piece, published in New England Journal of Medicine in 2016, really as a call to action to our people, to health researchers, to physicians, to anyone in the healthcare workforce who just reminding folks or teaching them for the first time in a lot of cases that we all have a role to play in dismantling structural racism and supporting Black lives. And in that piece, we really walked through sort of 5 individual sort of steps or goals that people can take to understand what their role might be. So, you know, you can imagine in 2020, and to be clear, between 2016 and 2020, many, many more Black people and Black men were killed by police officers. And we looked in 2020, after George Floyd's murder, at our 2016 piece, and we're, you know, simultaneously sort of proud of what we had put out there and the discussions that it had garnered, and also really disappointed, right? Because here we are again. And this time in an even more public space was this man dehumanized and his life, you know, and his breath stolen. And so in that piece, we wanted to make it clear, so we each have individual work to do, and also healthcare systems have to step up. This is not an isolated issue of law enforcement or crime or violence. We really have to be thinking broadly about what the role of medicine, of healthcare, of public health is in dismantling structural racism. And so we call for that, you know, in a variety of different ways through that piece. You know, everything from desegregation of the healthcare workforce, which goes beyond just diversifying the physician workforce, which we hear a lot about, but really thinking about who's caring for people in our hospital systems, in our healthcare systems across the board, and what would it mean to ensure that there's a diversity there that allows for a stronger tax base, a stronger community, and a more viable community. We talk about the need to really think about how we want to leverage accreditation to be able to demand that everyone go through some sort of anti-racist training, right? We wouldn't send physicians out to practice medicine without having taken anatomy and physiology and sort of all of the other, you know, basic sciences. And in the same way, if we are really going to dismantle structural racism and achieve equity, we have to expect a level of training for our healthcare workforce that addresses that as well.
Thank you, thank you. And going to Aletha, as we're sticking on this idea of just some of the written work you all have done since that time, I mean, and just we're talking about dismantling racism, structural racism, you have to be able to, you know, use that term, you have to be able to do research with that term, and you are one of the researchers who did an analysis in Health Affairs, Medicine's Privileged Gatekeepers, Producing Harmful Ignorance About Racism in Health. Where you were showing that, you know, many medical journals don't even address racism, and if they do, it's mostly in opinion articles. Tell us a little bit more about that kind of work and how that's setting that stage for dismantling racism in healthcare.
Sure. So, I mean, that piece was a piece, Rhea Boyd, Nancy Krieger, myself, Fernanda DeMaio, who's on my team, and the opportunity came up again, actually, because of, I was like, why did that come up? So JAMA, and kudos to, I know Kirsten is here somewhere, Bibbins Domingo, I don't know if she's in the room. Oh, she's over there. Who is the new editor, and just congratulations to all the work that she's been able to do. But prior to her, there was, you know, a big incident. There was a post that happened about saying something similar to like, physicians aren't racist. There was a podcast that was pretty harmful. And, you know, there was a lot, you know, and I just was a year and a half in working on the strategic plan, and then getting this challenge of like, well, if AMA is about equity, how does this happen, right? And then I put a post out on social media, and then it gets even more confusing. And because I have to distance myself from something like that, because I didn't know it was going to happen. And it's really important that we control our narratives as leaders in this space. And so I feel the piece that we did collectively with Rhea and Nancy Krieger was to elevate this context about the journals and what they are not doing, and that they aren't explicitly talking about racism. So what better thing to use of what journals do is look at the data and find the data and put that forward about the gaps that were existing across all medical journals. Really, maybe APHA, which is not is more public health, was more in the front line of talking about racism. Public health was, but the medical journals weren't. But this was about also recognizing kind of the power of these institutions to control the narratives, the solutions, what gets published, what's of interest, what's of value, what gets invested in, right? Because so many folks pay attention to it from the media perspective, right? Folks, JAMA articles get published and it's in the media, right? That's power. And then what's invested in from a policy perspective. People pay attention to the medical journals, whether we like them or not, who, you know, even AMA, you know, I hear lots of, you know, why would I be an AMA? I understand the history. I was not an AMA member before coming to AMA to work. I get it. However, it does have influence. They do. I see it. If the White House calls me, I'm clear of the influence, right? And so I think we have to be in these spaces. I think there's always an inside-out strategy, and you have to figure out what your best role is and for where you are in your life and what you want to do. And nobody can determine that for you, right? And so, you know, at this point of doing the work, a lot of what, to me, this is at this moment is the disruption of the narrative, but it's also pushing back on narratives and having the courage to do that in the spaces of which we are. I am no longer convinced that it's about the data. Data is important. Data is important for accountability. Data is important for measuring progress and where we are, knowing these disparities exist. But we have so much data. We don't need data to tell us that they exist. And so in order to change a system that is operated and managed and created by people who have powerful positions, whether it's money or political power, this is more about how do we change the will and influence the will of somebody to do something differently. And so this work in context, and this is why narrative becomes important too, the stories that we tell, who's telling the stories, that influence to shift kind of the heart set, but also kind of tapping into the values of those who are in leadership roles is very critical. And why, I value Rich, because Rich, and he's heard me say this before, has been that person since, I think, for the past 2 years, who we didn't have a relationship beforehand, but he reached out and he was like, I'm just checking in to see how you're doing. Like, that matters. And then you get proximate to somebody, and proximity is key. We are influenced by how close we are to people and communities. And so we influence one another, but you don't do that unless you are open to it and you're vulnerable to do it. And to me, that's my ask of people, and not just of Black and brown people, of white people, to be interested and to be open and to be vulnerable and to be proximate to the ideas and folks that you usually are not.
Thank you for that. Aletha, I mean, sticking with you on that point, you did a Q&A with one of my colleagues, Debbie Balthazar, when you were inducted to our 2024 status list. Rachel's also on our status list. To that point that you were just saying about this isn't just, the burden for Black and brown people. And I believe you, as you said, work should not be upon us, Black and brown people and those who've been historically marginalized. There's no way we accomplish justice without more people stepping up to be accomplices and understanding that they're in this house as well. How do we build that? How do we encourage that momentum beyond the context of allyship? Allyship, to me, is passive. We need accomplices. We all need to be stepping into this together if we're really committed and have the will for justice. Tell me a little bit more about that, about accomplices. And it very much sounds like you're describing someone like Rich here.
Yeah, when you hear that back, I'm like, oh, what kind of day was I having? That was my interview.
You were bringing your full self.
I'm exhausted. I'm just like, I'm there.
You were bringing your full self.
That's right. And that's critical, right? And I think that as my evolution and growth as a leader, the ability to bring my full self is honestly, I think, part of my success, right? And if maybe that's not the right way to frame it, but the ability to kind of influence and connect. But we should be able to bring our full selves. So to that point, Isabel Wilkerson has that quote. I don't have it by memory, but the quote about how we all are in this house that has been built, right? And we can't. It's ours right now, right? And we have to figure out, but we're not, as Black and brown people, we're not the only ones in this house, and other marginalized groups. We're not the only ones in this house. There are other folks in the house, which means they need to step up and start doing work and hold themselves accountable as well to this. And they need to, and I hate to say it in the context of they in that way, but we need folks to do this. Like multiracial coalitions are what actually create and drive change over time. Black Panthers have said, I pull upon that. It's not a new thing. This moment isn't even fully new to some level. We're just, continuing the fight and just, for freedom and liberation. And so we need more of us and not just us as Black and brown people to lead in this space.
And to Rich, hearing Aletha talk so much about the importance of accomplices above allies, tell us a bit about how your work, puts you in that category as an accomplice in this goal of dismantling racism, structural racism in healthcare.
Well, I mean, what it reminds me of is when I first took the job at the foundation. I was here at Aspen, and I was about to do a panel. We put out our county health rankings, and the focus that year was on race, place, and health. Mm-hmm. And I was on a panel with two black leaders, Shirley Franklin, former mayor of Atlanta, and Kevin Washington, the head of the Y. And Maria Hinojosa was interviewing us. And I was talking to one of our communications officers, and I said, what the hell am I doing on this panel? I'm an old white guy. What purpose do I have on the panel? And what she lifted up is, until white people can acknowledge their privilege mm-hmm. and see the importance of their role in solving the issues of racism, we're not going to get anywhere. The vast majority of institutions in America are led by white men. And so what it did for me was made me feel more comfortable in my own skin in this place, on this stage with leaders whose lived experience is so different from mine. And I fundamentally believe that my role, I am invited to some tables that they're not invited to. Mm. And I have the opportunity as a white man at that table to lift up the importance of addressing structural racism. Mm-hmm. And we as an institution have the ability to put our resources into this issue, which signals to others that regardless of what's going on in our nation and how unpopular it is to be talking about racism today, mm-hmm. We are still there, and it's important to stick with it. And, mm-hmm. and hopefully that gives our grantees more support mm-hmm. And ability to continue. But if white people aren't in this game, we're not going to see the progress we need to have. If it's left to be a problem for black women leaders to solve on their own, that's immoral.
I definitely want to turn to some audience questions, so get your thinking caps on there. But before I do, I wanted to ask both Rachel and Aletha, you have both started centers for health equity, for anti-racism, in some cases more than one. Tell us a bit about that journey, that struggle. Is that one of those steps towards dismantling structural racism, having these centers? I'll start with you.
Oh,
Rachel.
That is a challenging question for me to answer.
I only ask challenging questions.
I appreciate that. So I didn't say this in my earlier comments, but so I'm the founding director of the Center for Anti-Racism Research for Health Equity, which is based in the University of Minnesota School of Public Health. And I developed the vision for the center in 2019 and early 2020, before George Floyd's murder, mm-hmm. And put it in front of the leadership at the University of Minnesota, who were really excited about the vision, and put it in front of Blue Cross Blue Shield of Minnesota, who gifted me $5 million to launch the center. Mm-hmm. And I always say, this was before George Floyd was murdered in our community. I think the urgency of building mm-hmm. the center became very apparent in the aftermath of George Floyd's murder, right? Mm-hmm. And this strong desire for leaders and institutions to feel like they were doing something and being accountable. I think what I've learned as I reflect on the past 4 years is that urgency culture is actually really harmful to this work in a lot of ways. Mm-hmm. And so for me right now, thinking about the role of the center, where our goals are to develop and leverage data to create anti-racist research and build an evidence base, mm-hmm. or contribute to an evidence base that is driving change, both in community and also in policy. We are working on narrative change and mm-hmm. leveraging narrative change to disrupt the sort of status quo around our understanding of racism and race, and mm-hmm. really helping people to understand that we should be talking about racism, not race, when it comes to health inequities. Mm-hmm. And also, my goal and my dream with the center is really to build something within mm-hmm. academia, within the walls of academia, that's never existed. Mm-hmm. And I think, because I dream big, I was like, well, these are the things, these are the elements that I've never seen going through grad school, and also, as a young academic. And now I'm at a point where I'm like, oh, I understand why those things don't exist, right? And so the last thing I'll say about it, I think we have to be asking ourselves a critical question right now, particularly those of us who are in academia and are leading in that space, which is, can a center, an institution that is focused on anti-racism at its core truly thrive in institutions that haven't fully reckoned with racism and the 400 plus years of harm that racism has caused to the communities and has dictated how our academic institutions have built. And so what I'm seeing now is this sort of incongruence between the two, and which leads to really important questions, I think, about how do we continue doing this work and really embedding it and making sure it's sustainable while also sort of pushing back against the system that is saying, well, actually, this work was never meant to live here.
Right. Letha.
So I've started 3 centers and helped CDC do some of their internal work as well. And I wrote a piece called The Plight of DEI Leaders. I remember, I don't even remember the title. The limited protections is a part of it. That's how exhausted I'm getting. But the point of it is that, where I'm at, there's an element of where going through this work to me is completely harmful. As a leader doing this work, there's a lot of guilt that I feel because we're bringing teams along. I have a team of 60 people, one of the largest centers. And, the institution, none of our institutions are set up. I don't care where you are. People can point to AMA, and that's fine. But all of our historically white institutions are not set up to support this kind of work. The trauma-informed systems aren't there. And I remember when I left the New York City Department of Health, sent up, pull up the center. We had tools. People learned what it meant to understand their mental models, to challenge their mental models, put forward different strategies, so they did their work differently. However, the part that was missing was, well, how do we help the emotional aspect of moving through this work with groups of people so that not just the sense of safety or being safer, but just that it's healthy and not harmful. Right. And so, by the time, folks tend to be feel a level of burden, burnt out, very stressed. And so my commitment when I came to AMA was to offer like a trauma-informed kind of support and build that into the system, right? Because this work, for me, I have had the opportunity where I'm not just in a siloed center. There is the imperative, and I've had great leadership to support that this is to be everybody's work throughout the institution. Right. So that's been helpful. However, now even coming to AMA, because of urgency culture, and my own desire to push and to prove my own value, right? To prove the value of this work, there was that compelling kind of force to say, I got to get as much done as possible because the time is this. And also, I don't want these folks to not think that this work isn't meaningful, that we can't produce anything, and so, there's all these challenges of how folks look at me, as a Black person doing this work. So for doing this work at this point in time, I do feel it's necessary because we are, as I wrote in the piece, that we're stopping some level of the bleeding. I talk about a tourniquet being put on, but the tourniquet is not the solution. It's just a momentary thing to stop, because if we weren't there, the decisions that are made at these institutional levels are horrible. Right? Yeah. And so many people would be even impacted further. The outside organizing, the collective, in spaces like this, and the intersection of our ability to build coalitions that activate and are organizing, that's always been essential to pushing movement and driving change in our country, and we can't change from that. So it's an and. I would never say a Center for Health Equity is the solution for any of our problems. It's just a piece of it that contributes to that long-term goal.
Thank you. Audience questions. We have one right over here. And I would just ask that you keep your questions short so we can try to get a few of these in, along with a couple I still have in my head. Right over here. And say your name.
Thank you. Can I stand? So my name is Arshel Monsanto, and I work for an organization called Link Health. And I want to thank you all for being here today and opening up with the question around George Floyd really resurface some feelings that I had. So I do have a question, but I want to provide just a tiny bit of context first. So being from Houston, at the time when George Floyd was murdered, he had attended a Houston school called Jack Yates. And Jack Yates was a community leader that purchased the first park that Black people can go to 7 years after emancipation. And he's also the namesake for the school that George Floyd attended, which also coincidentally had the lowest test scores in the district, which caused the state to take over the school. So with that happening, like all of this is bubbling in the background in Houston in real time. So my question is, what, if any, like opportunities do you all see for intersections of public health and public education in the work that you're doing and how it trickles down to the local level?
Thank you. Thank you so much. Who would like to take that?
Yeah, I'll jump in. You know, when I think about the title of the session, Structural Racism in Health, I think that's an important title because it's not structural racism in healthcare. Healthcare is part of it, but as we've gotten into this work and we've established generational goals, one is about healthcare systems being equitable and accountable and meeting everyone's needs. But another is focused on economic inclusion for family well-being, because we recognize that if families don't have the resources they need, they can't provide for their children. And another is around equitable and healthy community conditions, because the way our education system is funded in America is racist. It's based on property taxes, and we have segregation in America that stems from redlining and other racist practices. And so if you just isolate healthcare as the issue, you're not going to get there. And I think that's why it's so critical to have measurements of racism. I spent my entire career in public health, and we would talk about health disparities by race. And you can only analyze what you've got in front of you. And if you're not looking at the upstream causes, if you're not able to measure racism, you're not going to come up with the solutions to the issue. And we're very focused on policy and narrative, but to get there, you have to understand that the driver is racism and not race.
Right. And Rachel, you spoke a little bit yesterday about measuring racism. Would you mind telling us just a little bit more now?
Sure. So, I sit in this space as a researcher where data is incredibly important. And for me, that's all types of data, to be clear. So just as much as the empirical, the quantitative data is important, we also are simultaneously lifting up the voices of folks who are sharing their wisdom and their expertise as people living and being impacted by racism every single day. So part of my big idea is really that as we are continuing to build this evidence base of racism as a fundamental cause of health inequities, although I agree, like enough already, it's very clear, and let's just change it, and how do we change hearts and minds? And also, I think data is incredibly important in that, and so we are working to move past this idea of, just reporting racial disparities in a health outcome to really say, we have to understand racism and the complexity of it, right? So part of that work, sorry, my daughter is calling me. Hopefully my husband can deal with that. It's really, how do we think about the intersections of all of the ways? So the education system, and I think actually George Floyd's life and is a really poignant example, right, of how the social determinants and and not having access to the best quality education or housing, or all of those sort of intersections that then are a root are because of structural racism, right? How does that impact someone's life expectancy? How does that impact someone's health and well-being? The end of the Soul and Breaths piece that you mentioned in the New England Journal of Medicine, we say two things. One is that George Floyd, when the autopsy was completed, was found to have had COVID in his body, right? And so to me, this intersection of police violence, law enforcement, and a global pandemic and health that was, clearly harmed his body in a lot of ways, I think is an important way to understand sort of the constellation of how structural racism shows up and impacts folks, and also, I think it's an opportunity to measure it differently.
Can I add just to that real
yes, go
quickly
right ahead.
as well? And I want to make sure it's clear that, and I'm not saying that we don't need to measure certain things.
Yes,
But but the point of change, like, I don't have to be convinced that we need to address racism, right?
Yes, yeah.
Pointing at my friend, and she doesn't have to be convinced that we need to address racism, but some people do. And I don't feel the point at which people do is necessarily related to using data. There's something else that's in there in terms of the will, the proximity, how we value, how we see each other, that inspires that, and the narratives and the stories that we have. And to the point that was mentioned, how we frame, this context around data. We've done it at the deficit model. That's the problem with public health as well as healthcare. And, when I was Deputy Commissioner in New York City Department of Health, and Linda Villarosa wrote this piece about maternal mortality, and it really inspired a lot of things that happened across the country. It was a movement piece. And after a while, and it was the first time New York City really had to step forward and admit we had this data, that showed this tremendous gap. But then after a while, I was like, well, how do these headlines help the communities in the neighborhoods that I'm serving? I don't want to hear over and over that Black women are dying 3 times more likely. Like, there's nothing inspiring about it. I don't know what the full kind of context for not only the individual, but the policymakers that inspire change. And so I point to, and I think that is an important context when we connect with communities and people. And when I say community, because we're all communities, the folks that we tend to be serving in different places we are. And so how do we shift that narrative? And I look to the work of Andre Perry, who's at Brookings, the Black Progress Index, where he looked across, cities across America, found where Blacks had the longest life expectancy, right? And then what was happening in those communities? He looked into that, right? And he published, it's online, you can Google it. And to me, it's assets driven, it's strength driven. We are a people of value, and we need to claim and hold that much more. The deficit model does not work. Those are the systems and tools, again, that are created that were not us in mind. And so I am all for, how do we do that? Because I feel like that pulls more people in and gets us out of the zero-sum conversation as well. What are the assets? How do we build from there? And oftentimes his data and evidence has really shown home ownership, wealth, all those contexts. That's what folks in these communities that have a longer life expectancy actually have access to as well. And so I'm more, at this point in my career, getting into that space and that point of the narrative.
Right.
And can I just add one thing really quickly?
Sorry.
Because it was the second point of the Stolen Breaths piece, was that we ended it, and this was based on the genius of Dr. Rhea Boyd, who was another co-author, which was that we said, and he was loved. Because we felt it was really important, given the deficit framing we're so familiar with, to remind people that this is a person who is and what was and is loved, right? And so we've really integrated that into the model for my research center as well, and as an opportunity to remind people that we all are loved, we all have have humanity that deserves to be respected and lifted up in many ways.
Questions. We had right there in the pink first, and if you can keep the questions short.
Thanks. Hi, Shauna Butler, nurse economist. Question for you. First of all, I wanted to bring to everybody's attention, the American Nurses Association has their National Commission to address racism in nursing. Very much like what you were talking about, Aletha, a window opened, policy was moved forward, and people are moving very swiftly. Rachel, you were also talking about how important as a healthcare professions. So while we've got work being done by each one of the professions, how do we collectively, as professions, healthcare professionals, how do we take this work and join arms so that we're not doing it separately, but we're actually doing it together for achieving that system level change?
Right. Anyone want to comment on partnerships in that sense?
I mean, so then this gets, okay, I'll stop. But so we have a coalition that we launched in partnership with IHI, the Institute of Health, Rishi Manchanda, who's I know walked in this room somewhere, who's the head of Health Begins. He was here, I don't know if he's still here, but is a partner. We have lots of partners involved across sectors. And this is specifically rooted in one, we didn't want to create something like another coalition in a way. But what we heard from the environment is exactly what you're elevating. One, how do we work across professions, I'll say, but also how do we learn from one another? How are we more in community as institutions of organized, whether medicine or health professions, that can learn from each other, but also put forth actions that aren't like duplicating or replicating or having to figure it out from scratch, right? And so that's what this opportunity provides, is the Rise to Health Coalition. But I think it's in its infancy. I think there are challenges in doing it on many levels, whether it's because of AMA and its, root. AMA does a lot on scope creep, which kind of, poses a challenge with being able to work with other folks, and I get that. I think, we have to push ourselves in that direction. Figure it out.
Usha has her hand way up there. Go right ahead, Usha.
Hi.
My colleague from STAT.
Can I hold it? Oh, okay. Hi, I'm Usha McFarling from STAT, and this is a great panel, so thank you all. You've really talked about the difficulties of doing this work, and I just wonder if you can address how you do it now when there's what I see as waning interest in funding and supporting DEI, and also active legal pushback against it.
Yes, thank you, Usha. That was similar to what I was thinking. I mean, I know in states like, I believe, Florida and some other ones where DEI is being outlawed in higher education in that sense. Talk to us a little bit about, how you're feeling now.
Rich, you haven't talked in a while.
Yeah, go for it, Rich.
Well, I think for a large philanthropy, we're in a very different position in that we are not looking for donors. We are fully endowed. We can stick with this. And so we're putting resources into civil rights groups that are providing defense for grantees who are doing this work, who are challenged. We stand by other philanthropies like the Fearless Fund that has been attacked for trying to, in a very small way, address the lack of capital flowing to Black women entrepreneurs. Right. And we recognize that when you do race-conscious work, one of our big policy areas is focused on maintaining the ability to do race-conscious policymaking, which if you're trying to undo systems that are racist, if you can't take a race-conscious approach, you're not gonna get there. And we're all in, but we recognize we are in a very privileged position to be able to do that, and that many of our grantees and those doing the work are really feeling threatened.
Thank you. Go right ahead.
I think the opportunity at AMA that I've been afforded is that I can hear and listen to the stories of different folks across the country, and that's been helpful. We've been coming together internally, AAMC, some other folks, of figuring out what's the right strategy at this time of how we best support the folks and the people who are in the states that are experiencing this, because we are all struggling really to figure that out the best, outside of saying we need to stay committed to this, right? In terms of, to Usha's question, from a personal perspective, there is no question about, this is the obligation, right? That as I feel, as a Black woman, what I've been passed down, this is our legacy, and we'll be completely, committed to this. And then the other piece to it is, during COVID, it was hard for all of us, and I started to do music therapy. The session before this was about music therapy and long COVID. And I started to go through sessions of music therapy. I don't sing, but I was like singing for my poor neighbors in the space. But my music therapist, said to me one day, Aletha, I get, you're fighting for justice and freedom, and it's all great. He's like, but remember, our ancestors were also fighting for our joy, and our rest. And I think the more that we can also do that for ourselves as leaders, but also inspire the teams that we work with and hold commitment to, what does it mean to experience joy as well as rest? We were talking yesterday about NAP ministry and rest is resistance, and how do we build those into not only our individual lives, but also thinking about that when we do have the opportunity to influence structures. What do we do and how do we create that change? And that's, again, bringing the fullness of who we are and being okay to say and claim our joy and rest, I think is absolutely critical at this time.
And then, Rachel, I mean, as we close out over here, what is giving you, I guess, optimism or that joy as we look forward towards, dismantling racism in health? Is there anything giving you joy right now in that space?
I want to say something about Usha's question, because I think it's important to recognize, we have, at least those of us, so I live in Minnesota, and, we have patted ourselves on the back for being a very progressive and liberal state. But what we're seeing right now is really concerning in that it's not just the Floridas and the in Texas where this pushback and this backlash is happening. We are starting to see it in all across the country. And so I don't want us to sort of, I think it's very easy, especially for us in states like Minnesota, to say, well, that's happening in those other spaces. And I want us to make sure that we are paying attention, because we could very easily look up on November 5th, which is Election Day and also my birthday, and be really dismayed and wonder how we got here. And it's because we, dropped the ball and stopped paying attention. So what gives me joy after that? So I would say, Elisa talked about rest as the radical form of resistance, and the NAP ministry and Tricia Hersey's work, which I have, it is amazing, and I share it as much as I can. And I try to live by those values, more so now than ever before, because burnout is real, and I'm realizing that if I can't care for myself and make sure that I am happy and joyful, then we all lose out, right? And because I can't do the work. My family brings me joy. My daughter calling me while I'm on stage brings me joy. But it's, and I think it's a matter of really stepping back and breathing, reminding myself, like, I want to be here for the long haul, and that means that I need to rest and I need to find joy every day.
Thank you. Thank you so much. Can we get a nice round of applause for our panel here? We are out of time, but thank you for this conversation. Just a big thank you to Dr. Rachel Hardiman, to Dr. Rich Besser, and to Dr. Aletha Maybank. Enjoy the rest of the conference, and if you have any questions, feel free to come up to us and ask us. Go right ahead. Thank you so much. Hey, thank you so much. That was really